Hello, my name is Dr. Roman at Pacific Park Family Dental. Today, I'd like to discuss a subject that a lot of patients want an answer on, but there's not very many answers online. So, these are the most searched questions on Google that patients frequently ask. So, for your convenience, I'll just explain everything here so you don't have to go anywhere looking for this information. What kind of drugs do we use for IV sedation? We use a little bit of fentanyl, and we use a little bit of midazolam. And again, I know fentanyl gets a bad rap. Why does it get a bad rap? Well, of course, fentanyl is on the street killing people. What's happening? Yes, fentanyl is so potent. It's such a potent drug that we don't measure it in milligrams. So let's say we measure everything in milligrams. We measure antibiotics in milligrams. We measure drugs in milligrams. We measure midazolam. It's one of my sedation drugs. We measure in milligrams. Fentanyl, we measure in micrograms. It's 1,000 times smaller than a milligram. So why? Because the effect that it has on the mind, on the central nervous system, it can suppress your breathing so quickly if you're not careful with it. And this is something that people don't understand on the street. They just sell it like candy, and you can't. It's a powerful, powerful drug. So you absolutely need to dose it right. And we've been trained how to dose it. This is why we don't overdose on these things. We know exactly how much to give. So you give approximately 20, 30, 40, sometimes 50 micrograms and see how the person responds. And what you're waiting for is a gentle relaxation for the person to feel. They start to feel a little bit of euphoria. They start to feel relaxed and happy and cheerful, and the nerves and the stress kind of goes away, and you know that what you're doing is correct and it's working. So fentanyl is the feel-good drug, and midazolam is the forget your worries drug. Once the midazolam is administered, you will not remember anything that's happened. But those two separate drugs, when they're mixed, they create a synergistic effect. What that means is that if the effect of fentanyl is this much, and the effect of midazolam is this much, together, it's not added, it's more, without the suppression of your breathing. So that means you will still breathe totally fine through sedation, but because those two drugs are working on different receptors in your head and in your central nervous system, you get a more profound relaxation. You get a more profound sedative experience. So that's a wonderful way to do it. And this is why we do it this way, and we have fantastic success. Moderate sedation is one of the safest types of sedation to do. I don't think there's any deaths that have been recorded from moderate sedation, unless, of course, the dentist mismanaged the medications. That's a different story.